Gabby Trach, an 8th semester nursing student. Today's date is January 19th, 2022. And today for my skill video, I'm going to be checking off on how to section a trach and then followed by how to provide care for a trach. Prior to entering my room, I've gathered my supplies here on this table. I've assessed that my client is able to cough and deep breathe as well as swallow. I've assessed their respiratory system and listened to their lung sounds. So I'm going to go ahead and enter the room, perform hand hygiene. Good morning, Miss Smith. I'm Gabby. I'm your nurse today. Today we noticed that there's some secretions building up in your trach, so we're going to go ahead and section those out. And then I'm going to also provide some care around that trach and clean it out for you. So if you can give me your name and date of birth. Good. I've provided privacy by pulling my curtain over there. I have my oxygen and my suction hooked up. For my oxygen, I'm going to go ahead and hyperoxygenate my patient real quick while I set up my fields. My suction is turned on to continuous and it's between 80 and 120. I'm going to place a towel over my patient's gown to keep her as clean as possible. And now I can go ahead and open up my suction kit. And I'm going to open up my sterile gloves. I'm going to grab the cuff of my first glove and slip it on. And my second glove, I'm going to grab underneath the cuff and slide my hand in. And once I have them on, I can go ahead and adjust my fingers into the right place. Now that I've done that, I can go ahead and set up my sterile field. I have my sterile water I've just opened. I'm going to dump that in my tray here. And now I can open up my suction kit. And I'm going to use my dominant hand to wrap my suction around. With my non-dominant hand, I will break sterility to hook it up to my suction tubing, so I will no longer be sterile with my left hand. And I'm going to continue to hold my left hand down at the tubing. So now I can go ahead and test my suction, making sure to prime it with some sterile water, which it does look like it's working. So now again, with my non-sterile hand, I can remove her oxygen. And I'm going to go ahead and enter without suction. And on my way out, I'm going to intermittent suction. I'm going to be doing this for 10 to 15 seconds each pass. I should wait 30 seconds in between each pass to give my patient a minute to rest. And then I should also not do this longer than 5 minutes total. So I can clean out my section again and make another pass. And then on the way out, suction intermittently. Give my patient time to rest, and I'll do one more pass to clear up all those extra secretions. And on the way out, intermittently suction. And that's all for that skill, so I'm going to go ahead and unhook my suction tubing, wrap it in my gloves, and dispose of these into my trash can. I'm also going to dispose of my kit that I no longer need. And now we're going to go ahead and provide trach care. So I'm going to provide hand hygiene and giving my patient a minute to rest still. I'll go ahead and open up my trach care kit. Make sure that opens. And then I can go ahead and put on my second pair of sterile gloves. again, same process. I'm going to go ahead and put on my first dominant hand, holding the cuff of the glove. And my second one, I'm going to go underneath the cuff, slide my hand in, and now I can adjust my fingers to the right spot. Maybe. There we go. Adjust my fingers. And now that my kit's open and I'm sterile, I can go ahead and open up my sterile field. Get out my sterile water and my hydrogen peroxide, my trays. I have my ties here and my cleaning supplies. So I'm just going to lay it all out, maintaining sterility. Now, this cotton tip broke sterility, so I will not use it because it's outside of my sterile field. But I have 3 still, so I can use those. So I'm going to go ahead and place in my trays. All of them will get normal saline. I can dispose of that. And then one of them gets 50% normal saline, 50% peroxide. So I'll dump my peroxide into the second tray, dispose of that. And I can go ahead and break sterility with my non-dominant hand, my left hand, to take out the trach, the inside of the trach. So I'm going to go ahead and break the sterility. I've grabbed my trach and I'm going to go ahead and place it in there to clean. Let it soak for about 30 seconds or so. Lift it up. And now I can clean the inside of it with my tips, cotton tips. Dispose of that. And then again, I can use these to clean the outside and the inside. Dispose of it. Clean it again. Dispose. And one more time we'll go around this side. Dispose. And now we're going to soak it again in my sterile water. Once I've done that for 30 seconds, now it's considered clean, so I'm going to go ahead and lift it up with my dominant hand that is sterile. And we're going to place this back in. Lock it in. And now we're good to go. The last thing I'm going to go ahead and do is take out my old gauze, my 4x4. So I'm going to use that with my non-dominant hand, dispose of it, and I can grab a clean gauze with my dominant hand and clean all around the trach, making sure to get all the secretions out of the way, any buildup, dry spots. Once I've done that, I'm going to dispose of it and I'm going to let that sit until it's completely dry, because I don't want that to sit underneath the skin, so then that can cause skin breakdown. Once it's clean, I'm going to go ahead and insert my new 4x4. And now it's underneath the skin. I no longer have to be sterile for changing the trach tie, so I'm just going to use these as normal gloves now. And I'm going to apply my new trach tie before I remove the old trach tie. So I'm going to apply my first one, have my patient lean her head forward so I can apply this one all the way around, making sure that it's not tangled up in the existing one. And once I've secured that down, now I can go ahead and remove the old tie. Then I'm not worried about the trach coming out or being dislodged. So now I can remove the old trach tie. dispose of that. And now I can just go ahead and adjust this and see that it needs to be tightened up just a little bit here. I want to make sure that I can still fit about 2 to 3 fingers though, and it's still protecting, the pad is all the way around the skin, protecting her from skin breakdown. I'm going to go ahead and clean up my supplies now, assess my patient one more time, make sure she doesn't need anything, pain, potty, positioning. I can reposition her back down to a comfortable sitting. Once she is good, I will go ahead and leave the room, document what I did and how I provided care and suction. I can provide how much suction secretions I got out of the two, out of her trach, also the characteristics of the secretions. I will also document how she tolerated both procedures, and that's